Hello, everyone. Welcome to our webinar today. My name is Chad Erickson, and I'm the Vice President of Strategy at MyAdvice. And it is my esteemed pleasure to welcome everybody to our webinar. Joining me today, we have a special guest, Dr. Earl Ferguson. He's a board certified plastic surgeon in San Antonio, Texas. And Rachel Matza, who's one of our senior practice consultants. Anyway, today's topic, we're going to be talking a lot about some of the changes in healthcare right now. We're talking about weight loss and how to market, how to really differentiate, how to really stand out in this, and how to really use this effectively. And so, love that we've got both Dr. Ferguson and Rachel here with us today to talk about both aspects of that. Just kind of setting the table for today. We are live right now for those who are here with us. Thank you for being here. We know that there's some who middle of the day, not always easy, and you'll be able to watch this on a recorded version. So we are recording, and so thank you for that. Also, we welcome your questions. So if you've got some different questions, I'll moderate those, and you can add those right to the chat or the QA section, and I can of course present those to Dr. Ferguson and Rachel. But as we get started today, so as I mentioned, Dr. Earl Ferguson is a board certified plastic surgeon in San Antonio. But Dr. Ferguson, why don't you take a minute and just do a little more of a deep dive and introduction of who you are and some of your background?
Sure. So just real quick, I started my career in the military. I was a general surgeon for 8 years before moving into plastic surgery. I did my full 20 years with the Air Force and then transitioned into civilian life. I was with a derm group for the past 9 years and then went into a solo practice last year. So I've kind of done it all. Most of my career has been a mix of reconstructive surgery and cosmetic surgery. But as of last year, I'm moving into the purely cosmetic space.
That's wonderful. Well, congrats on that adjustment, and more importantly, thank you for your service to our country.
Thank
We
you.
really appreciate that. Rachel, my gosh, Rachel recently transitioned from being one of our marketing coaches into a sales role, and she was I'm gonna let her talk about it, but she was so nervous when she did that, and I'm like, felt like I was pumping her up every day. I'm like, you got this, you got this. A little bit of that self-doubt. I'm like, oh my gosh, you're one of the most competent people I know. And I was so excited for her because she's so great at helping people. Rachel, tell everybody a little more about you and your background.
Hi, everyone. So like Chad said, I've been with MyAdvice for going on about 4 years now. I started here as a marketing coach. I was on a team helping our clients be the best they can be every single day. And then, yes, I took this nice leap into becoming a practice growth manager. And it's been just wonderful. And I'm still loving helping clients. A lot of what I'm doing now is more starting out, clients who are just starting out, and that is really just something very special. So I'm very happy.
Thanks, Rachel. All right, well, let's tackle the elephant in the room. The hottest topic that is being talked about at every single medical conference that I attend, and I go to a lot of conferences, is about medical weight loss. And there could be the good, bad, and the ugly that are associated with that. But Dr. Ferguson, let's start with you and let's talk about what you're seeing in the industry today. What's happening? Where's this being driven from?
Yeah, so I'm always one that's a little hesitant to jump onto fads. So when this whole Ozempic thing started happening, I kind of wanted to watch it for a year or two before I really jumped on board to see if there's any downside to these things. Because a lot of times, things that look good in the front don't end up being so great in the end.
Sure.
But as time went on, it just became more and more clear that the benefits were real and there were very few side effects or downsides. And it seems that every week or month that goes by, there is some new benefit that they're describing for these things. So I initially started it just because I was seeing a lot of patients that, plastic surgery is not a weight loss procedure. And so I was seeing a lot of patients that I was encouraging to lose weight. and many of them had been trying for years and just had no ability to do it. They plateaued, and in spite of working out every day and sometimes feeling like they were starving themselves to death, they just could not shed the weight. And I felt, short of surgery, there wasn't a whole lot I had to offer them, from a bariatric surgery standpoint. And a lot of them just aren't interested in that. So to me, it seemed as time went on that it was just more of a win-win proposition. So I decided if I could start offering this to the patients, they would benefit. And if later down the road they decided they wanted to get some body contouring done, that benefited me as well. So I think it seemed like a situation where everyone could benefit, and we decided to move forward with it about 6 months ago.
Awesome. And Rachel, what are you hearing and seeing as well as you're in the trenches every single day and consulting, dozens of practices?
Yeah, so most of my current aesthetic med spa plastic surgery practices were now starting to add it on. As an add-on, as Dr. Ferguson was saying, a lot of the times before you have some of these plastic surgeries, you're told to lose weight. So a lot of our clients were seeing this as a way to get their client to that next step. But what we're also seeing, and I found this extremely interesting, is we're finding also wellness clinics opening up that are really specializing, narrowing it down to this is what they're doing. And they're being really specialized in it. So I'm seeing both it as an add-on and also both as a very specialized clinic now. It's been very interesting. And they're both attacking it very similarly, but also very differently. When you are very much specializing in it, it's the only thing you're doing. It's, it's marketed one way versus it being an add-on, and talking about that and how that client looks.
Perfect. Dr. Ferguson, I mentioned the good, bad, and the ugly at the beginning. You're in a unique spot, right? You're a board certified plastic surgeon. You understand the importance of the right BMI before you want to go in and operate, and people help you get to their ideal weight. But there's also the competition sometimes, as Rachel mentioned, it's not just people using it as an add-on who really understand the body composition. It's like, oh, it's almost a charlatan approach right now, is what it feels like, a wild, wild west. So in that scenario, how do you differentiate yourself in this market? Because I think there's others listening who are, you know, dermatologists, board certified plastics, those that are that really understand body, that are wellness doctors that really, really get this and this makeup of the patient, and they're probably kicking, against the wall sometimes. Just like the competition I've got to put up with probably some nonsense is tough. So what are you seeing, and how do you deal with that, and how do you differentiate?
Yeah, so I just sort of looked at this as something that I could offer my patients in an environment where I could monitor them closely, make sure that they were controlling their symptoms, follow up with them whenever I needed to. I'm a very hands-on guy, and I don't like the idea of turning my patients over to a lot of times people that I have no idea what their qualifications are, if they have any at all. And many of these things were online or on the telephone even. You just call in and tell them what you want and they ship you something. I don't like that approach to medicine. I like to be able to lay my eyes on the patients, make sure they are healthy, make sure that they can call me if they have an issue and we can make adjustments. And I just think it's the right thing to do. And I don't think you're going to find that at a lot of these wellness places. I'm sure there are good ones, but in general, I just don't think that they're going to know how to manage problems like a board certified anything really, internist, surgeon,
Sure.
whatever it is. I just think that they're not going to have a grasp of the situation, and I think they, while adverse events are rare and just you hardly ever see them, they happen. And I think you need to know how to manage those things, and more importantly, how to recognize those things when they occur. And I think that may just be beyond the scope of some of these places.
I think you're right. Um, what I do love about this, and you mentioned it earlier, is the additional benefits that continue to come up. I just finished personally reading the book called Outlive. I don't know, have you read that book
I
by
have
Dr.
not.
Peter
No.
Attia?
No.
It's a fascinating book, but he really talks about medicine 3.0, right? Is where we need to be, in preventing, the four horsemen of diabetes and heart disease and cancer and
Right.
Alzheimer's, right? And understand it's like, boy, based on the American diet and other things, uh, we've gotten behind. And so,
Mm.
but medicine in the world today is about 2.0. It's when you hit a certain level, hey, we'll do all we can now that you have diabetes. We'll go
Right.
ahead and treat that, as opposed to, you know what, if there's some indicators that your A1Cs are high or other things, let's do more preventative things. So it's not just about the weight loss. It can actually be so many other health benefits that are out there. And so
Right.
it's
And I think that's actually a really good point because, a lot of times we're targeting all of the things that occur because of obesity rather than the underlying problem. We're
right.
treating their arthritis, we're treating their hypertension, we're treating their cholesterol, we're treating their cardiovascular risk, whatever it is. Whereas if you approach it from the beginning and treat the root cause of all these things, then
Exactly.
you can eliminate all those other medications.
And that's a lot of the point of the book was, yeah, let's get ahead of these things, and we can do that. So yeah,
Yeah.
it's critical. Um, Another question for you, Dr. Ferguson, before I kind of throw it over to Rachel and a couple of questions I have for her. What changes did you have to make within your practice to be able to bring on this weight loss side?
So I did have to do a little bit of exploration on where the best places to get these medications were. I wanted to make sure I was getting them from a legitimate source that could be trusted. So we did some research on where some other places across the state were obtaining their medications, compounding pharmacies and such. And then we had to kind of set up a system for screening these patients and figuring out how we were going to coordinate with them. And we have it set up currently where we see the patient initially, get a set of labs, and if everything checks out, then we order the medications for them, give them instructions on how to use it, and then I see them once a month. And I like laying eyes on patients. I sometimes I get a little bit of pushback on that, but I can tell a lot just by looking somebody in the eye and tell whether they're healthy, and whether it's working for them, and if we need to make adjustments rather than a phone conversation. So I tend to be a little bit strict about that, but I think safety is paramount in any type of situation, and we want to make sure that their weight loss is not too rapid. And if they're not losing any weight at all, then maybe we need to adjust that as well. So there are 10 to 15% of people that don't respond to these medications. Obesity is multifactorial, and if the insulin resistance isn't part of the makeup for them, then that may not be beneficial for them.
It's great, and I'm sure it took a little work, but yeah, you do it the right way, get your
Yeah.
staff on board, figure out some of those basic things that you want to do. But I applaud you for really being diligent about wanting to see everybody on a monthly basis. I think there's I'm sure your patients appreciate that, because what I'm seeing and hearing myself is that there's the relationships right now are becoming stronger than ever. And I think that that's just, if you think about that, it's an investment, right? And where will that pay dividends down the road? But again, it has to be done right. And so, anyway,
Right.
thank
And
you
you're
for doing
building a
that.
rapport with those patients,
Yes,
and they will trust you with other things down the road if prove to your patients that you care about them. And there's not a whole lot of benefit to me unless they do something down the road. I mean, you do make some money off of it, I mean, the margins are not
sure.
huge, and honestly, it's not really why I'm doing it. It's more to get these patients in the clinic, make sure they get the treatment they need, and then if I can offer them something down the road, great.
Well said. Yeah, because yeah, if you do lipo now and then they lose a bunch of weight, is that really
Yeah,
what you wanted? Or breast
exactly.
augmentation now, and all of a sudden they're like, hey, I just lost 30 pounds, and
Right.
now the work that you did based on where they were, you're like, oh man,
Yep.
that's not my work, right? And
That's
it's
exactly
yeah.
right.
So
I mean, it
Yeah.
really is a timeline and a spectrum of treatment. And if you do it in the right order, they can get phenomenal results that they'll be happy with for years.
Yeah. Yeah. Perfect. So Rachel, I brought the point earlier that this is hyper competitive. Um, and so let's talk about the marketing side. Because there's also some challenges, obviously, in things that can be done and cannot be done, with, so you don't get shut down by Google. And obviously Facebook is, Meta, we'll call Meta because it's Facebook and Instagram, has some very strict guidelines around this. But you do want to go talk about the marketing for a minute?
Yeah. So I think the first thing, honestly, when we're talking about starting to market it, is to first, and Dr. Ferguson kind of touched on this, but remaining true to yourself as a doctor and as a practice. So if you are a doctor that is going to now see clients, patients every month, going to check up on them, that's a way to market. There are practices that aren't going to do that, and that's part of their marketing. But I think one of the biggest things and keys here is to talk about how you stay true to yourself as a practice. I've had people call it something different. For instance, I've had people call it the skinny shot. A lot of my doctors, that does not resonate with. It's a marketing strategy to call it something else, but it doesn't resonate with a lot of, especially board certified plastic surgeon, doesn't resonate with them because it's more than just a skinny shot, right? So from a marketing standpoint, we want to make sure that we're first starting there, that we're in line with what we're currently doing. And then from there, we want to figure out what are questions that people are consistently asking. That's really going to help you with Google, and adding that type of content to our websites. That's really what I think is the biggest thing here. What are the questions that people are currently asking? We also talked about, Chad and Dr. Ferguson, you both just kind of touched on it, like the pushback and stuff that we are seeing out in the media. How do we address those things? That is good pieces of content for us to address, which is going to help you set you apart in this highly competitive playing field right now. Because some people are just, okay, we do semaglutide, we do tirzepatide, go. That's kind of it. But it's okay. I'm really well versed in this, and I can really help you change your life. And that's where your marketing, that's the most important thing to highlight in your marketing. The other thing I wanted to talk about there is we were just talking about kind of lifetime value of a client and a patient. So what I have seen from a marketing standpoint is, you said you have everybody come in once a month. One of my practices, what they were doing was every time that person came in, that once a month, they were offering them 10% off of Botox, 10% off of a filler, because as you lose the weight, some people are going to start losing the weight in their face faster, and so, to now add on another service to have them stay a little bit longer, we have to do Botox every, 8 months. Now we're getting them in for a different procedure or different service, now. And then from there, once they've lost all their weight, they're coming back to you for that tummy tuck, that full mommy makeover. So now we've expanded from, let's just say, a year. This is now a 3-4 year relationship.
Yes.
Yeah. Rachel, I'm glad you brought up the lifetime value of the client. There were some numbers that were put out by the American Society of Aesthetic Plastic Surgery a few years ago, and they estimated the lifetime value of a plastic surgery patient is between $80,000 to $120,000. And so yeah, I don't want to say that the medical weight loss is the gateway drug, but I think it's part of the overall health of a client and should be considered and shouldn't be ignored. And from that, yes, the relationship is there, because there's other things. They care about their body, they care about their looks, their appearance, their beauty, and their motives don't matter, right? That's a personal decision. But if along this journey we can help somebody be healthier, look healthier, be in a more optimal way, then why not, right? But the marketing is critical, right? Having the right content on there, having knowing what keywords are really working, doing the research, and understanding, should I be adding videos to my website? Do I guess kind of get testimonials and all those parts that are going to continue to build that and help that content grow and be sustained over time are absolutely, phenomenal. Um, Dr. Ferguson, what happens, do you find anything when it's not working right, for somebody, can you switch from semaglutide to tirzepatide, and how long do you go with them before you determine where you need to make some changes?
Yeah, so that first initiating dose is really meant to be subclinical. So while you do have people lose weight sometimes right off the bat, I tell them to probably not expect that with that first 4 weeks of treatment, because we increase the dosage every 4 weeks, and I just tell them it's to get used to the nausea, the decreased appetite, all of those things are most common with the initiation of treatment, and then each time that the dosage is increased. So the initial treatment is very small and what we consider subclinical, and it's just to get them used to the symptoms. And I like to set expectations up front so that they know that and they're not disappointed. Most of the time, we let people do the first couple of months before we talk about, possibly either skipping a dose and going up a little higher, or just switching out entirely to something different. So one thing that I've not really seen literature on this, so I can't really recommend it from that standpoint, but some patients have told me that intermittent fasting in combination with this has been beneficial in getting them kind of over that hump when they stall out. And sometimes it can be as simple as just not eating anything after 8 p.m. and not having anything till 8 a.m. the next day. It doesn't have to be anything really difficult. It just kind of resets your body a little bit and gets the ball rolling again. So different things work for different people, and I am always learning myself just because all of this is kind of new. But I think all of it is good from everything I've seen. You just got to keep an eye on them and make sure they're not having any of those adverse effects. The most common, of course, being the nausea. 15-20% of people will get that. Usually it's that first day or two after initiation, and then the first day or two after each dosage increase. But that subsides, and it's almost always manageable. And for most people is a small price to pay for the benefits. And I just wanted to kind of tag on to the benefits from a health standpoint. From surgery, it's not just beneficial aesthetically for them. It makes them a better surgical candidate overall. It makes their anesthesia safer. It makes their recovery easier. It puts them at lower risk for delayed wound healing or seromas, or any of the things that we worry about in people with poor nutritional habits. And it just makes their end result better as well. And I try to explain all that to them up front. And I think if you take the time to explain these things to people, they're very open to it, and they actually appreciate the education. So I think there are good ways to approach this, and we're always fine tuning that as the more we learn. Um, I have had a number of patients that have been able to get off multiple medications while they've been doing this. And I just had somebody last week tell me that their total cholesterol dropped almost 30 points in the time that they've
Oh,
been on it. They were talking to their doctor about starting a statin, and with the weight loss, they no longer need it. So it's every week, it seems, from a cardiovascular standpoint. Or just last month they came out with that flow study describing the improvement in chronic
yeah.
kidney disease. I mean, it's just crazy. And the downsides just seem to be extremely limited. I mean, there may be something that comes up down the road, but right now it just seems like really an amazing thing we got going here.
Yeah, it definitely feels like it. So, Rachel, you have a unique experience as well because you've been through part of this journey. So, for our audience who's listening, be a lot of practitioners, but you come and now kind of tell your story a little bit of where you've been and where you're going. Because I think it's great that that the practitioners understand from a client perspective, was your mindset and where are you today?
Yeah. So as of today, I've lost 130 pounds using both semaglutide and tirzepatide. So yeah, it took me about a year, a little bit over a year. And you know, I really didn't intend to start this weight loss journey. I had no desire to, I don't like diets. I didn't want to do anything like, and it was actually my fiance who had gone through the bariatric surgery, who at the time had came home and said, this is a great alternative. And it was fairly new. And I let him do it because, again, you know, like Dr. Ferguson said, let's wait and see what happens. And he was doing fantastic. And it was like, oh, okay, let's try it. And I tried it and I was like, this is life changing. This is not, okay, I'm doing this and nothing's going to happen. After about that first month, after that initial, you know, dose and the first initial 4 doses, and then you're titrating up, you're seeing real results. Not just on the scale, but you're seeing real results in your health. Or, you know, those non-scale victories. I have a 3-year-old. You know, I was able to go from not being able to really run around with him. He's super active. You know, boys are really active. I'm able to run around. I'm able to have the stamina to keep up with this kid. You know, it gave me back my life. So a
Hmm.
lot of what's happening is that you're not just affecting people's health. You're not just affecting people's health. Yes, they're able to get off of medication. I actually was able to come off of my Hashimoto's medication because my levels
Wow.
leveled. My father also on tirzepatide. He was a diabetic. He was able to come off his diabetes medication. You know, so it has changed my life. But for me, it was really just, I went from not being as active as a parent to being able to run with my kid, go on the playground, do all these things. So you're changing lives. And I think that's something as a doctor and as a practice to keep in mind when you're talking to your patients. Like you're changing lives. You're giving people a whole different life. So yeah,
It's awesome.
that's where I
So,
stand from this.
Rachel, thank you. Congratulations on your journey. Let me ask you this question, Rachel. It's actually a two-part question. Um, because I think this would be something really, really great for all of our practitioners to hear today. What did you enjoy about your experience with your practitioner? And what is one thing you wish that they would have done that they didn't as you've gone through this journey?
So, okay. So like Dr. Ferguson, my doctor was consistently following up with me. So every month was following up with me, seeing how I was doing, taking my blood pressure, you know, making sure that I was in optimal health. Um, the thing that I wish my practitioner probably would have discussed more with me, so maybe this is more of a discussion base, and I guess it depends on the practitioner and how much they know. I wish somebody would have told me more about the other things you need to do besides just taking the medication. So, for instance, I lost a lot of muscle. And I wish somebody would have told me, hey, that's going to happen unless you do X, Y, and Z. Um, Also, Dr. Ferguson was just talking about what to do if you stall, right? Um, Stuff like that. I had to start kind of figuring that out on my own. My doctor knew some of it, but it was only brought up when I brought it up. It wasn't a very proactive approach. So what I would say is if you are a practitioner prescribing these medications, to also take a proactive look at your patient and say, okay, this is what's going to happen. These are the other things that can happen. You might stall. These are the things you can do. This is the diet you should probably be eating. I know for myself, I had to up my protein intake a lot. I had to get on a multivitamin. You know, a lot of these things because I didn't realize all this stuff was going to happen. So that's one of the things I could say that I wish my doctor would have been a little bit more proactive in those other things. because I understood what the medication did, I was injecting myself, how to inject myself, all of that. So that's
Great
kind of,
advice.
yeah.
No, I think
Yeah, I think
that's
the
great. I
protein
think
thing is important as well. Just you know, people don't have an appetite, and a lot of these folks have to force themselves to eat. And so even just doing protein shakes, that kind of thing, I think it's really important to reinforce that to people. You know, they get excited because they're losing weight, and they love the fact that they're not hungry all the time, and they don't have the cravings. But I try to, you know, keep reminding them that, you know, you still have to eat, and you know, you got to maintain a healthy diet. And I think it's easy to lose sight of that just because they get so excited that they don't feel like eating all the time.
yeah, it's perfect. Dr. Ferguson, where do you see things going with this medical weight loss over the next, if you had a crystal ball, right, or the next 6 to 12 months? You know, I don't want to go too far out because I think it's almost impossible,
Yeah,
but over the next, let's say just the next year or so, where do you see it going?
I think this whole field is going to explode. This was sort of an incidental finding with an existing medication. It was not developed for weight loss. It's kind of like, you know, Latisse with the glaucoma treatment. They noticed their eyelashes were growing. So same
Right.
sort of thing. Now that people see how enormous this market is, they're saying this could be the largest pharmaceutical market in history. And so everybody is scrambling to develop, you know, new ways to capitalize on this. So and some of it will work and some of it won't. Some of it will be safe and some of it won't. We'll just have to see how it plays out. But I think it's pretty exciting. You know, we're still currently just using the drugs that were developed for other things. And I think if you can fine tune those things, and just like tirzepatide, you know, adding in the GIP on top of the GLP-1, you know, that boosts the response in a lot of people, and you know, increases the alacrity of the weight loss and the amount of weight loss. And so I think, you know, the more things, the more this is explored, and the larger that population base gets, the more we're gonna get these amazing drugs. So, and anywhere there's money to be made, the pharmaceutical industry is going to be pouncing on it. So I
Yes,
think
they
it's kind of
will.
exciting. Yeah.
It is very exciting. Rachel, as you continue to go out and help practices with their marketing, what are a couple of the biggest takeaways they need to be thinking about as far as how to really set themselves aside and apart from others, and make sure that they're really coming from an educational standpoint? What do they need to do to attract new patients?
Yeah, so they really, what you just said, they need to be very educated. They need to be able to answer all those questions straight off the bat from again, what we were talking about earlier, from a content standpoint, as many, as many videos we can put on our site, explaining the process, explaining how things work, testimonials, that stuff that's really going to set you apart, as this develops and goes on. Before and after pictures. This is a harder thing to show, like a breast aug. You're able to show it after, a month. This is obviously something you have to follow, but following somebody's journey is really important to this whole entire process. So that, this is what practices are going to need to do. And then again, what I was saying is, making sure that it also makes sense in your practice. If you're doing one thing and it really doesn't make sense to do in your practice, maybe put it, start it a different way, or it might not make sense at all. So, you need to make sure that it fits in correctly. And, I think Dr. Ferguson touched on this a little bit, but the other thing that's really important that people are looking for is making sure that you are board certified, that you are, you are who you say you are in this field. You're the right person to go to, because there are unsafe people to go to, because you just want to get that shot. We need to make sure that people know you're the safe route to go. So
If I could just piggyback onto that just a little bit, the before and afters on this, one thing that I have found works very well. We don't do these like typical before and afters. We have the patients submit candidates to us, them, out doing something before they started this journey. and then they send us a picture out with their friends or whatever after the weight loss. And I think that to me is more effective than trying to show medical photos of people. That, people see these things and they're like, wow, they know they're legitimate and undoctored, and that patients are really getting these types of changes.
I agree with you. Being able to show a lifestyle, right? We're marketing, break it down, right? We're trying to sell, right? The idea is that with marketing, we're trying to fill the top of a funnel with more prospective clients. So we're not trying to be shy about that. But then we have to think about what is the patient mentality, and the patient mentality very clearly is a lifestyle. And so being able to show those photos, and you're kind of selling the dream of,
Yeah.
man, that's me right now. And I feel I love my friends. mean, my personality comes out, but maybe I'm not comfortable with my body. I want to be a different weight, and I want to be able to maybe run with my 3-year-old. I want to be able to fit into these jeans that I wore a few years ago. Maybe a new pair, but you know what I mean. Just that size, that whatever it is, they want to be comfortable in their own skin, and it's the same. We work with a lot of dentists as well. They worry about their smile. Like some people see this, or smile's always like this, never showing teeth. But if they can, also they're like, wow, I want to show this off, and that's what we're selling. We're selling the outcome of what people can really achieve through this, and so that's a huge part of the marketing, and understanding that that's what the patient journey is. That's what they're looking for, and we're in a great spot to help them. Um, Final closing words, Dr. Ferguson. Any final things you'd like to add to what we've already talked about today?
Yeah, just kind of what you're talking about, this lifestyle thing. It's funny to me, these candid shots. A lot of times in the befores, they're sitting on a couch, or they're sitting off by themselves somewhere, or whatever. They're almost always sitting. And then in the after pictures, they're always partying with their friends or what. And these are not things that I request from them. This is just how it turns out. And I think it's very interesting how their lifestyle changes, when they lose that weight. And I think that's very effective from a marketing standpoint as well, because these are
Definitely.
I don't solicit that. I don't send me your sedentary photo and your exciting photo. It's just how it always is. So.
Yeah, that's awesome. Yeah, great advice. Rachel, closing thoughts as well.
I mean, so since we're talking about it, I will just, before we leave, if we can, let me see if I can just take my blur off.
Oh, wow.
Wow.
And that is the difference, right? I'm happier. I'm living my life. You can see the affect in my face. So to what you're saying, that's that. And honestly, that's the best marketing right there. To see somebody go from, not from looking very unhappy in their life to having this great life now, being able to, do all these things in their life. That's the best marketing you could possibly have.
Yeah, for sure.
It's awesome. Well, thanks to both of you, and Rachel, thanks for sharing your story as well, and it's very brave of you, and that's awesome. And I was going to say that the glow isn't just because you've lost weight; you're also recently engaged. So congratulations on your engagement as well.
Congratulations.
So very, very exciting. But Dr. Ferguson, thank you for joining us and sharing some of your wisdom
Yes,
and
sir.
part of your journey as well. It's very, very encouraging, and I love your approach to what you're doing, and very holistic on really helping your patients. And I think our audience today is going to really have a lot of takeaways from that today. So again, this is being recorded. So for all of our audience listening either live or after, thank you so much for joining our webinar today. We appreciate you, and we'll talk to all of you at our next webinar. Take care. Bye-bye.